Water is the very essence of all life, from the ocean shores to the Great Lakes and rivers, and finally to the human body, both inside and out.
We are so excited that you have decided to take the time to become acquainted with the countless benefits of aquatic physical therapy. Hi, I'm Roxy Tesmer.
And I'm Jill Corda.
We are here on behalf of Midwest PT and Sports Center. We will give you a brief overview of how aquatic PT can be used effectively for a variety of patient types in order to assist them in achieving their rehab goals. Aquatic therapy has been a proven success from post-op surgeries such as rotator cuff repairs, lumbar fusions, total joint replacements, and traumatic ankle injuries, to name but a few. The buoyancy and the gravity-reduced environment of water and the feeling of weightlessness and suspension work together in the warm fluidity to aid in muscular relaxation. Many patients are able to begin movement in the pool earlier than with other types of therapies. For most, the earlier they begin movement, the shorter and more effective the rehab. When prescribing aquatic therapy to patients, keep in mind that motion through water increases efficiency, mobility, muscular strength, and balance. It also decreases pain, muscle spasms, and edema. So, now that you know a little bit about aquatic therapy, let's dive right in.
Let me take you through some of the injuries and conditions you should consider when making patient referrals for aquatic therapy. The natural buoyancy of water is particularly good for patients who are usually inactive and for those who are guarded due to fears of re-injury. A growing body of research supports that after an ACL surgery, patients are able to regain knee range of motion using the properties of water and may begin walking and running much sooner.
My name's Jamie, and I just recently had a back fusion in my L5 to S1. They took the disc out and they put a plate in there with 2 screws. So before we decided to do the surgery, I had done months and months of physical therapy on land. And it helped a little bit, but my body just was not strong enough to work very hard on the land therapy. Since I've been in the water therapy, it's been amazing.
Back pain patients who can't exercise on land feel more comfortable in the water and report decreases in pain and overall improvements in their quality of life. Lymphedema is improved when treated in the warm water environment. The hydrostatic pressure also allows patients with lymphedema to move without the aid of compression garments.
Having the water therapy helps me be able to exercise against resistance. It's a lot easier for me than land therapy. I've never really been a good person for exercising, but I seem to enjoy the water therapy a lot better.
In our continued commitment to expanding our specialty treatments, Midwest Physical Therapy and Sports Center is focusing on cardiopulmonary benefits of exercise in water. Patients with congestive heart failure and other heart conditions have found movement through water to be more inviting than traditional land-based exercise. Here's a list of some of the diagnoses that we often see in the pool. As the practice of aquatic therapy continues to grow, experts in our field also advance in their research efforts, exploring the benefits of water to the health and fitness of the human body. So why is water so effective in physical rehabilitation? This is due to several factors: the buoyancy of water, water temperature, hydrostatic pressure, improvement of body awareness, proprioception, trunk stability and balance, and improvement in patient morale and confidence. Buoyancy is an upward force that actually reduces the effects of gravity, relieving pain. With buoyancy, sensory input goes to the brain first, overriding the pain impulse. For back injuries, the buoyancy of water serves to unload the spine at the water level of C7 by 90%, the xiphoid process by 70%, and the level of the iliac crest by 50%. Water temperature also plays a big role here. With the optimal temperature between 91 and 94 degrees, the water naturally decreases pain sensitivity and relaxes muscles, creating a more comfortable environment for the body. This is especially helpful for pregnant women and older adults suffering from arthritis and edema. Hydrostatic pressure in the water helps to stabilize and maintain equilibrium. It also helps to improve posture and reduces the chance of microtrauma. Research has also found that rehabilitation in water improves body awareness, proprioception, trunk stability, and the extremely important increase in balance.
I had gone to 2 other land therapy clinics, and it helped my lower back and sciatic nerve and knee, not at all. So I went back to the physician a 3rd time and told her that I had researched water therapy. Could she suggest a place and to give that a try? And she knew a physical therapist at Midwest Physical Therapy, and so I went there and started water therapy, and I just totally recommend it.
Let's take a closer look at balance. A great concern we have for our older adults is that over 1/3 of people over 65 will fall annually. The stats become more worrisome as people get older. At the age of 80, over half our senior citizens will suffer from a fall. Water provides a safe environment for the elderly to improve balance and strength. As an experienced PT, I consistently see an increase in morale and confidence in my patients, which allows them to progress more quickly through the process. It's our hope that once they've gained both strength and confidence, that they'll continue an exercise program which will move towards balanced wellness for the long term.
Some of the common patient concerns include fear of the water, feeling self-conscious in a bathing suit, and the need to put their heads underwater. During our initial patient evaluations, we can calm those fears and reassure them of their safety and our commitment to their personal comfort in the pool. Thank you so much for your time and willingness to become more aware of the many advantages of aquatic therapy.
We hope that when you consider aquatic therapy for your patients, you will keep in mind Midwest Physical Therapy and Sports Center's successful aquatic program. We are committed to patient recovery as they move through water to wellness.